Well, hello there. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Well, what I want to talk to you today is about neuropathy. And you're probably wondering why a chiropractor started to treat neuropathy. Well, basically, because medical doctors really aren't. I mean, if there's no pill, you're basically out of luck, which is not a good thing because neuropathy just doesn't go away on its own. It's usually it gets started with either diabetes or chemotherapy, or if you drink too much. I'll be honest with you, if you drink too much, this is probably not the right thing to even be listening to because you won't get any better with neuropathy if you don't stop drinking. And I'm not saying it to be cruel, but it's just alcohol is sugar, and the sugar eats away the covering on the nerve, on the myelin sheath. And so your nerves don't conduct as fast as they could because of the excess sugar. As far as diabetics, they monitor their glucose levels, and then post-chemotherapy patients seem to do well with the program. But what I want to go into is what I call the Precision Nerve Reset Program. When you have peripheral neuropathy, I'm not even going to go into the symptoms. I mean, you got to have like pain at night in the legs. And there's a reason why that I feel you're going to have more at night, because when you're laying face down, it's harder for your heart to pump blood. And actually, when you're laying down in bed, your heart is at a different level than it is when you're standing. When you're standing, it's going to have just gravity alone help get more blood flow to the lower extremities. Okay, and you're going to feel it in the hands as well at times. But majority of people will have peripheral neuropathy in the legs and the feet, and it does start to cause some problems because one, lack of sensitivity is really more serious than anything else. Way, way more serious. People can burns, cuts, not be aware of it. So foot health is very important. Like seeing a podiatrist on a regular basis to make sure your feet are well cared for is a very good idea, and I would encourage you to do so, regardless whether or not you do the Precision Nerve Reset program that I've come up with. So we're trying to think of it as more of a paradigm shift in how we treat neuropathy. Okay, I'm going to tell you something up front. I don't cure neuropathy, but then again, no one else does. What I try to do is I try to make the nerves work better and more efficiently. Nerves need a couple of things. They need nutrition, they need stimulation, and they need blood flow. And those are areas we can address, and we do address. And I'm going to go into more detail as we go, but this is the main, and that's why the only thing I want to digress is if you have peripheral neuropathy and you're lacking blood flow, you're not stimulated. You can stimulate the nerves as well. And we have many different ways. And I'll touch into each of them and hopefully try to keep today's podcast a little bit shorter. But you need to have a certain amount of nutrition, okay? If you're not watching your glucose, if you're diabetic, the system's not going to work for you, so don't bother. But we have seen a number of advanced therapies that, and listen, I'll be honest with you, a lot of insurance doesn't cover advanced therapies. They're there for like emergency care only. So let that truth be told. But there's certain supplements that I have found to be really, 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 really effective. And it's one that has B vitamins, biotin, vitamin D. It makes it easier to take instead of a whole handful of vitamins. Some of the real exciting things too is we're going to have like shockwave therapy. Shockwave stimulates mesenchymal nerve cells. Okay, and so in other words, mesenchymal is like stem cells as well. And so you stimulate regrowth from a vascular standpoint on the micro level using shockwave therapy. Very, very. These therapies aren't painful at all. Another thing we're finding is infrared light therapy. So if you want to get fancy, photobiomodulation, great term, but think of photosynthesis. Photosynthesis for nerves that just aren't working properly. So the light actually dilates the blood vessel, and it also produces nitric oxide. If you're wondering what nitric oxide is basically what works with the active ingredient for Viagra and those types of ED pills. And so But infrared light is a way to dilate, stimulate nitric oxide production. This causes vasodilation. And that's just two different therapies, okay? Now, we also have a thing called StimPod NMS460, which was originally used by surgeons to find nerves during surgery, prior to surgery. And we've been using it with great success on firing up the nerve. Okay, your nerve, some of the nerves fire at 280 miles per hour. And when that slows down, guess what? You can have neuropathy. So this stim pod is like waking up these peripheral nerves. And, we see people come in and it's not painful. So far, actually really none of the treatment is really painful. But, some people are afraid because I'm a chiropractor, it's going to hurt them. This is separate from chiropractic completely. But what happens is that StimPod NMS 460 really sends a signal and wakes up the nerve. It's kind of like when you ever read a book that you read a long time ago and you're like, wow, I forgot this, I forgot that. Well, it's waking up the nerve and does a great job where we see actually the nerves working. The patient, when they're receiving the treatment, are feeling the nerve working. So it's pretty effective. But that's not the only thing that we do. Some of the stuff that sets us apart is thinking outside the box. Because you definitely want blood flow. Blood flow is, like I said, blood flow, nutrition, stimulation. But in order to stimulate the enhanced blood flow, we do is we work with a vibratory plate. Okay, and the vibratory plate sounds like you maybe see them. Listen, they have them on Amazon for $300-400, which is fine, but it's not going to do the trick. This is a vibratory plate basically on steroids if you go that far. And what happens is we use blood flow restriction bands with vibratory plate. Okay, now vibratory plate gets the blood flow restriction bands are placed, primarily on the upper thigh. What it does is it kind of blocks venous return. So when you block the venous return, you're going to experience a deficit. And when you do on the vibratory plate, you're really working it because when you're on the vibratory plate, you feel it. It feels pretty good times two. But in a sense, when blood flow restriction bands come off, that blood's going to come rushing in, and blood will help heal damaged nerves from peripheral neuropathy. So it's a good thing here. Now, for some serious cases, and they all run the gamut. Some people, I noticed the people post chemotherapy start to get better pretty quickly, which is good for the patient because it brings the cost down. But anyhow, some patients, if they're low on oxygen, the oxygen saturation points are low, we use exercise with oxygen therapy. And it is a very powerful way to fire up the capillaries, microcapillaries in the body which exist. And it's a fantastic way to wake the body up and get the oxygen it needs. Because you think about it, it's kind of like, remember that E85 gasoline that came out, I think, during Bush administration, where it was cheaper and they use alcohol. Your car doesn't run the same. Well, your body's not going to run the same if there's an oxygen deficit. And a simple test will determine whether or not there's an oxygen deficit, and we can correct that by having you do exercise with oxygen therapy. So I've actually pointed out some of the core pillars of the nerve reset that we do in the office. Some of the stuff at home that we definitely go into, you have to think, your nerves aren't sending you the right information. What are we going to do about it? Well, balance exercises, and to get balanced exercise to really work, we've got to consider called the VOR, the visual ocular reflex. It's how information goes into the ear through the different canals. You have anterior canal, posterior canal, horizontal canals, and these are all supposed to balance out in this fluid inside of it. If you ever had dizziness Sometimes you have to correct the canals and how the fluid moves through the canals to repair and imbalance issues. It's very effective. It's called a Dix-Hallpike maneuver. I think everything I've outlined so far is really not painful. But going back, if you're going to do the program, you got to do work at home. You got to take the supplements. You have to watch your sugar intake. You have to. We've kind of revitalized the whole program. And basically, so we should reclaim your quality of life. Okay, and if you do nothing, your quality of life is going to diminish, and you should understand that doing nothing is not going to get you anywhere. So the other thing we do home is we send you home with this powerful infrared light. It's a 10,000 watt laser, and it dilates. You put it on an area turn on for a minute, and you hit different areas in the legs and the hands and the arms. If you're experiencing peripheral neuropathy in the upper extremity, that is it's a huge game changer because you can do this every single day at home, and you can do it twice a day to really start seeing the results. And that's the key thing here is we want the results. So you have to do homework. If you're not going to do homework, this is not for you. But it's just something to understand and consider, okay? And what I'd like you to do is, I've created a whole protocol, the precision nerve reset, and it's in a format, it's a booklet format, and hopefully you've already received it, and you've gone through it. But it will go into more detail as what you can do and how it works. A little more technical, like proprioceptive retraining it teaches the body how to trust signals from the feet again, rather than relying on vision. Okay, that's the visual ocular reflex I mentioned just moments earlier ago. So what happens there is when you do these home-based exercises, it's going to drastically reduce the fall risk, and it's going to amplify the in-clinic results. So we want you to regain independence and mobility. You're lost, it's not so good, Another thing too is let's go over into the vibratory plate, the whole body vibration with the blood flow restriction bands. That's a lot of places are starting to use blood flow restriction, but I don't think they're doing it with the vibratory plate, which is really just very, very, very powerful. But you're going to get microcirculation boost. The blood flow restriction with the vibratory plate, it dilates small blood vessels to drive oxygen-rich blood to the extremities. Guess what? It's part of the getting better process. The other thing too is vibratory sensations travel faster than pain signals, so it closes the gate on chronic pain messages to the brain. So stuff is really really powerful, and I think what happens is people, first of all, I'm going to be right up front. Medicare does not cover it, so it just doesn't cover it. I think we have affordable care plans, but just understand Medicare does not cover it. Never have, never will. When you lose a limb, then they'll cover that, but they're not going to prevent you from losing a limb. So this is, again, pointing out the key features. Now, again, the blood flow restriction, it rebuilds muscle safely with light resistance. It reverses ischemia, which ischemia is like poor circulation. And it also helps improve insulin sensitivity. So there's a lot of powerful stuff in this program, and fortunately, not going to get it anywhere else, that I know of. Okay, people tout to treat neuropathy, and you go to neurologists, have at it. But you're taking a medication that is pretty much anti-seizure medications. You got your Lyrica, Cymbalta, gabapentins. Those are all very, very powerful anti-seizure medications. It's going to dumb the nerve down. It's going to kind of take it. If you're a teacher and you have a dumb student, making them more dumb, most dumb. Okay, so the shock wave we saw about before, there is stem cell activation, and it kind of recruits the body to repair the damaged tissue and reduce inflammation. It kind of helps. Again, the shock wave is a very comfortable treatment. It interrupts the pain signals for immediate relief and breaks up deep tissue adhesions, which is going to happen if you're not active as you should be. You got to get up and move around with this thing too. That's a different thing, and we'll cover in another podcast where we really go into much more detail on the home exercise program. So touched on, well, actually, for the stim pod, there's another one I really go back. Stim pod is just hard to imagine and really hard to describe, except it really works. And what it does is a pulse radio frequency and delivers specific impulse to stimulate nerves and encourage regeneration. So, like I said, I've got a pretty good program here. I really do, and I'm proud of it. And we are helping people, but again, it comes down to, if you can't afford it, you can't afford it. I'm not here to spend your money for you. But if you value your health, I think you should take a look at the program. And if you have any questions, you can always feel free to give me a call. 203-656-3636, 203-656-3636. And if you haven't received a copy of the home exercise protocol, we do workshops where we go over the home exercise protocol quite often. All right. So, not quite often, basically every other week. And that's free at no charge. You come in. So you got to do, again, you have to do the home exercises. If you're not going to do the home exercises, let's not waste your money. So again, I'm Dr. Brian McKay. We call this Neuropathy at Core Health. I'm a chiropractor, and this is the Precision Nerve Reset Program that is making a difference in many people's lives. Hopefully, I can make that difference in your life together, because it's a together approach. This is not come in, pop a pill, and hope and pray that's going to get you better. It just doesn't work that way. Again, I hope you found this informative, and I will happy to answer any questions. You have a great day. Take care.